Hello, my name is Wander. I'm a level one nursing student. Would you mind giving me a spot report on your patient?
General Wonder, my name is Manny. I'm taking care of a patient in room 231. Her name is Shanana O'Connor. She's a full code. She's a universal precautions are in effect. Drug allergies says trimethoprim sulfate toxalsol. It's a mouthful. She has a history of diabetes mellitus type 1. And the drug allergy that she has with this medication, she get a rash. She came with fever with on the mid origin. She's end stage renal disease. Fluid restrictions 1500 milliliters. Vital signs Q4. Activity as tolerated. Notify there's an order for notifying the MD if temperature goes above 101 or BP goes above 180 over 100. Came in with fever and chills and general malaise. Client reports numb and tingliness in the lower legs. Maintain O2 above 92%. She quit smoking 2 years ago, and she has symmetric chest expansion. Her vitals were as of 7:30 this morning 101.1, 95 heart rate, O2 is 96, blood pressure is 138 over 78. Client reported weight gain of 110 pounds for the past few weeks. Her BMI is 26.1, and she's on daily weights. Blood glucose checks before every meal in a sliding scale. She's reporting decreased appetite, and a UA was done. It's positive for white blood cells. The urine is amber and cloudy. Patient reports recent decrease in urination and no pain. And she has a saline look, right? Medium vein, 18 gauge. And she has an intake of fluids of 375 mLs and putting out of 200 mLs. She came when she came originally. She reported pain of 4. Right now, she's having no pain.
Okay. So why specifically is this client receiving this medication?
Well, this client is receiving medication because the labs here realized UA. She has elevated white blood counts, so it's a possible infection.
Okay. What action does the medication have on the body?
Independent binds to the bacterial cell wall, resulting in bacteria and cell death. Bacterial cell death. Okay.
Alright. When should you question administering this medication?
You should always question administering medication when there's any possible allergic reaction or cross reaction with other medications or signs of dizziness, some diarrhea, nausea, and vomiting, which are side effects as well.
Okay. Does the medication have a therapeutic serum level?
It does not.
No. Okay. Which vital signs must be monitored?
Well, in this case, you monitor all the vital signs. We're keeping a close eye on the temperature and fever and white blood cell count as well.
Okay. Which physiological parameters should be monitored when the medication is being administered?
I would check for anaphylactic shock and pruritus, and make sure that there's no sign of laryngeal edema, and make sure the IV as well is not infiltrated inside, it's not feeling warm to touch, and it's not showing in the side of the IV.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital?
Well, the client, I will make sure that the client be aware of his own body temperature, that know if they're running a fever or not, and also to always make sure the IV size is good, in good shape, and it's not showing any signs of irritation or phlebitis, basically.
Oh, okay. What interventions must be taught for taking the medication safely at home?
I would suggest the same approach. And make sure the IV site is clean. Make sure it's using a aseptic technique if a medication is administered through the IV site. And make sure to keep an eye on the IV site. Make sure there's no sign of redness and swelling.
Okay. What are the side effects and potential adverse reactions?
Well, side effects with medication we mentioned earlier is a rash, is pruritus, is sweating, urticaria, nausea, vomiting, diarrhea, stuff.
Okay.
Okay.
How would you know the medication is effective?
Well, I would know if medication is effective. This infection subsides. Um, there's no more temperature. White blood count, I would check on that. I would check the labs as BUN and creatinine for as well, kidney functions, stuff like that.
Oh, okay.
Okay.
All right.
Any other questions?
No, that's
Okay,
it.
at this point, we're going to go into the patient's room. We're going to introduce ourselves and we're going to get medication, okay?
All right.
Hello,
Hi.
Mr. Connor.
Yes.
Hi, my name is Manny. I'm your nurse today, and this is one of my student nurse.
Okay.
They're giving you some medication.
All right.
Have you ever had imipatin before, Celastatin?
No.
Okay, so this medication might give you some side effects, and I'm going to tell you the side effects now, and then if you can remember them for later, okay?
Alrighty.
Side effects are nausea, vomiting, and diarrhea.
Okay.
All right. So at this point, I'm going to wash my hands. Should you wash your hands too?
Infection, she has fever, and her culture came back positive for E. coli, and we're gonna administer the antibiotic.
Gloves on?
Gotta have the order. Does this information affect how you administer the medication? No, because it's an IV antibiotic.
So, Mr. Connor,
Yes.
I'm going to read the bracelet, but can you tell me
Teaching that we did?
your age, last, first name, date of birth?
Shanana O'Connor, 34 years old.
Okay, you check that against the medical record. Shannon O'Connor, that's right. And do you have any allergies?
Yes, I do. I know it's a long name, but I know it's a sulfamide.
Okay, and we look at the allergies. Okay, that's correct, showing that she has and the medical record showing that she has an allergy to sulfa drugs. What signs what symptoms do you get with that?
With that, I get a rash.
Okay, thank you.
You're welcome.
Very good. Okay, so now we're gonna first thing I'm gonna do is I'm gonna give you some fluids, okay?
Okay.
Doctor ordered some fluids, and it's gonna be continuous infusion. So we get the medication. We gotta make sure we had the right amount. Check the bag for any any holes, any cloudiness, and make sure expiration days in the medication. So we're gonna make sure for that it's the right medication, the respiration. We compare against the medical record. We make sure it's we have the right route as well, the right patient. Okay, so we check the medication as sodium chloride, which is normal saline, 0.9%, and it's 30 mL per hour, which that's what we have here,
Okay.
and to be given continuous infusion. Okay, so Mr. Connor, can you read me your ID?
Sure. It's 842-3343-660.
Okay. This time I'm gonna input the medication code. Okay, and now we got the verify green button. That means it's the right medication. And we check one more time, and I'll make sure just in case, to ask her for her last name, first name again, just because I like to double check that because it's very important. You give me your last name, date of birth.
Shanana O'Connor, 34 years old.
Okay, we'll compare one more time. We got the right route, the right medication, everything. Okay, so now I'm gonna spike. I'm gonna spike the IV bag, and always gotta be careful because this side over here is sterile and this is sterile over here. So take the top off and keep that. You always have to make sure that IV is clamped. Now, when you have this clamp and spike, you can hang it over here, and then you can go ahead and flush the IV. And the saline lock, the tubing I can do this just by hanging it in here. It's all clamped, it's sterile. The tip is sterols, you can see it has a cover, so I'm gonna go ahead and flush the IV. So with IV, you always want to maintain aseptic technique, so clean, 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 for 15 seconds. So you initially you put back to make sure you get some blood flow, and then you push in, not fast, just slowly push in, and then you make sure you have to clamp or doesn't go in, and then you can clamp it again, and you can leave that there so to maintain the sterile. Now I'm going to go ahead and connect the dial flow to my IV tubing. So I can do the same thing with the dial flow. We have to make sure to use to clean, clean, clean. Clean, clean, clean. Make sure it's sterile. Okay, we connect it, and now we put it on open all the way. And now we can go ahead and unclamp the tubing to prime the tubing itself, so there will be no air bubbles, which is very important. Make sure the chamber gets some fluid back first. Okay. So clamp. Okay, there we go. It's taking a little bit longer to get the air bubbles out. That's okay. Make sure there's the port there's no air in the ports. There's no air. If there's air bubbles, you just have to kind of like flick it a little bit. Check the line. Okay, that's good. So now you clamp it one more time. And this side over here is sterile, so at this point you can take the I want to get another piece of alcohol just because, you know, infection control. So this is all sterile, and you clean, 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 clean one more time. You connect the airflow. It's all good. Okay. So now you don't want IV to touch the floor, even though it's, you know, there's no, but just in case, you know. So I'll put it over here. I'll make sure it's on clamp, and I'll put it on the right dose, which is 30 mL per hour. So I'll put the dial flow at 30. Okay. So clamp. And there you go. This tubing is not the best, but it's going. That's what matters, and you have to unclamp this as well. So there you go. Okay, so now we document the site.
Hi, Mr. Thomas. How are you? Good. My name's Aisha.
Right.
Nurse, and I have a study nurse with
In vein.
Watch his let's give you some medication. Okay.
The time is now, which is
it's gonna be out of your IV, okay? The normal saline is just gonna run
300. So we make sure we document all the information. So normal saline, 0.9%.
I'll tell you all about it. there's a little bit of side effects, which I'm just gonna explain to you right now. And then once we're done, I'm gonna ask you if you understand.
30 mLs per hour.
Some side
So
effects
just bear with me,
include
I'm putting
diarrhea,
information.
vomiting, a rash, and some severe reactions. to
Charting is just as
procedure.
important.
Um,
Initials.
dizziness or some hypertension. So if you feel anything like that, you definitely need to let me know so that the call button, okay? So I need you to verify your last name, first name, date of birth, please. My first and last name is O'Connor. Thank you. And do you have any allergies? Yes, I are.
Okay.
Yep, it's Bactrim. It's a sulfate, so you're correct, and I'm checking it out here.
Okay, we go. It's safe. Finally. Okay, so that is done. So now we're gonna go ahead and administer the imipen, celastatin, which is gonna be IV piggyback. So you make sure that will make sure that there's no make sure the patient is not allergic to this medication. She has an allergy to sulfa, which it doesn't interfere with this. And you call pharmacy always to make sure the medication you're giving doesn't have any contraindications with the normal saline she's receiving as well. So you can you give me your last name and date of birth one more time?
Yes, it's Shanana O'Connor, 34 years old.
Okay, thank you very much. And then we'll make sure we check that one more time against the medical records. Okay, and it's gonna be IV piggyback, 500 milligrams. Make sure the expiration date is still good. And to be given over 8 hours. So we're gonna set that diet flow to 100 milligrams per hour. Milliliters per hour, milligrams. Okay, so we make sure the order is correct, make sure the right medication, make sure the right route, the right patient, of course, that we just checked. So can you give me that your ID band one more time, man?
Sure, it's 842 3343 660.
Okay. So one correct. So now we're gonna put the medication barcode. Okay, so there you go. We got the green light. Can you see it? Good. Alright. Registration time.
I like it too. I was like, that's why I told him, you can get it from like the dollar store. You can get it
It's
from
1600.
Yeah, there you go. That's smart.
Alright, at this time I'm gonna get my tubing. I'm gonna connect it to spike the bag. So this is gonna be all sterile, so you have to make sure not to touch it. So there we go. And I'm going to do a backflow. So I'm gonna put it lower. And by doing so, I'm gonna do to clean the port first. Clean. Plug it in. Okay, so I'm clamping out.
I'm checking your side. No redness or tenderness on here.
Clamp it.
Gonna scrub it. Clip it in. Take the cap off. This is sterile.
Okay, that's good. There we go. It's running through. Now I want to clamp it one more time.
And pull back.
I want to hang the medication. I can hang it on the same side. I just had to lower.
Do you feel any
I want to hang it over here.
burning or anything?
And I'm going to lower the main one. And to make it lower. So this is the secondary. This is the primary. So now I had to change the rate on the diaflow. So since I had a 30 initially, now I want to change it to 100 because we want the antibiotic to run through. So it's going to be, I'm going to set it to 100. Okay. And we're going to unclamp. Are you doing okay, ma'am?
Yes.
Okay. At this point, I'm gonna document. Hour. Initials. Okay, we got the documentation done, so now we can save. Okay, I'm gonna issue with the computer over here. Just give me 1 second. I think my computer might have froze. Okay. Okay, here we go. Thank you. Thank you. Internet is a little slow. Alright. So that's put in, that's documented. So ma'am, do you remember those side effects ask you to remember for me?
Yeah.
Can you repeat it back to me?
There were nausea, vomiting, and diarrhea.
Okay. Now at this point, I want to make sure, for future, for the nurses coming on, make sure to put the this is just to state that the tubing is good for 4 days. So put today's day, and then I'll put my initials and the time. So. I would do that to both lines. Second line. Okay. Let me clean up my mess over here. How you feeling, ma'am?
Fine.
Alrighty. At this time, I can take my gloves off. Wash my hands. Wash my hands. I give the patient the coli. Make sure she has a coli, and we lower the bed. We ask her if there's anything else she needs.
No, everything's fine. Thank
Okay, and then she can call us in case she needs something else.
you. Okay, we'll do.
Thank you. Any other questions for me?
Yes. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Well, yes. At this point, before administering medication, the first thing you want to make sure the medication is supposed to be given to the client, and hasn't been canceled by the physician, and then you want to verify the reason for medication, such as infection, which would be a positive white blood count, a UA, and that she was running a temp, for example. Okay.
All right. Did this information affect your decision to administer the medication?
Yes, it does, because that will give me the go-ahead to administer medication. If the patient wouldn't have needed this medication, she wouldn't have the values that she did on the lab work, the laboratory testing, which was UA, and also I would check for signs of allergy, any reaction, any contraindication this medication might have.
All right. Did this information affect how you administer the medication?
I go back to the same. So yes, it did because also I will have to check the medications to be administered the correct route, correct dose, correct patient, and make sure the medication is accurate and current.
All right.
Okay. Anything else you have with me?
That's it. Thank you very much.
Okay. At this point, we're going to do some charting. You can follow me. You can see what it's done.
All right.
All right. Thank
Sounds
you.
good.